So Heather Downey, I am the Director of Clinical Data Science Services at CareSight. So I lead the informatics piece for CareSight.
And most of you know me. I'm Donna Montgomery, and I am the Chief Clinical Informatics Officer for Lone Star. And my responsibilities at Lone Star are our intersections with customers, how they use our system, how they adopt, and what things can we do to better solve their problems.
What are clinical and IT leaders experiencing that CareSight and Lone Star will be solving? And Heather, we'll start with you.
Sure. So one of the most common themes we see across our hospitals, and Donna's going to speak more to this, is about the amount and volume of data that they're all sitting on. And it's untapped, it's unstructured, and just getting access to that has always been an obstacle. Most of the data is coming from many different types of systems. Even within one hospital, they have numerous systems. And then you think about a health system as a whole, and you start duplicating the volume of vendors. So we're really looking to help them solve the problem of being able to tap into that data and form that data into actionable insight.
The only thing that I would really add to that is that, going back to how many different IT systems are within hospitals. We've spent the last probably 15 years in healthcare implementing technology in the practice environment. What we've learned through those implementations is that there really has not been a lot of attention focused on how do we bring all the data together so that people can really understand what they're seeing in these different systems. So one of the common things that you'll hear in hospitals and the IT and the clinical leaders talk about is we are data rich, which means we have a ton of data, but we're information poor, meaning they have all these reports, they need to try to put them together. They really don't have time to do that analysis, and it's super hard for them to be able to pull that together. So really the reality of what happens is they give up on it. And so they have all this data, but they're really not able to solve problems. And they're really struggling with that because that's actually, they know it's there somewhere. So being able to have visibility is something they're really looking for.